Your first 3 years, you're really spending a lot of time on diagnostic rotations, and you don't have as many dedicated IR rotations as you have during the later years where you're almost strictly doing IR. But on those diagnostic rotations, we're so heavily involved in procedures, whether it's MSK, doing aspirations, injections, biopsies, body, we do a lot of CT-guided procedures involving biopsies and abscess drainages. Mammography, we spend our entire rotation doing breast biopsies, and all of those things I think get you a lot of experience in the procedural skills. One of the other things that we do here that really is important for developing those skills is ultrasound. We learn to perform ultrasounds under the teaching of our sonographers. We perform them overnight and on-call settings, and it's an important skill to have, but I think it really helps our procedural skills, because many procedures, you're getting access or you're doing your biopsy under ultrasound guidance. It is nice, of course, that we don't have too many fellows here. As a resident, you kind of have a higher level of responsibility because we're really the ones who are running the service, which is a great, educational experience in itself. Since we aren't too large of a program, there's enough IR rooms to go around that every resident or fellow that's on service can be in a different room within a different attending, doing a procedure all at the same time. I can't think of a single time in the times that I've done IR so far that I had to stand behind another trainee and not get to be involved. Fourth year, there are some core rotations that we need to do. We spend a lot of time, of course, in IR. We do some other ones like ICU. We spend some time with vascular surgery as well. Here, we spend a rotation where we're with the vascular surgeons and going in on their endovascular procedures and rounding on the patients as well, again, because that clinical management is important to understand. Our neurointerventionalists, we have a few of them who we get to work with. We do a rotation where we're exclusively working with them and doing whether it's the aneurysm repairs or stroke cases, doing thrombectomies. We get to spend dedicated time with them and doing those procedures as well.